Good evening. I'm Mayor Ron Nirenberg with Bexar County Judge Nelson Wolf. Tonight we're joined by Dr. Anita Kurian, who is our one of our executives at Metro Health, also in charge of our vaccine operation. We have City Manager Eric Walsh, as well as Jane McCurley, who is the Chief Nursing Executive from Methodist Healthcare. And this is our update of COVID in the San Antonio community. Let's go right into the update. As I said on Tuesday, the region's positivity rate has risen to 21.4%. I also want to note a critical issue related to the surge in our hospitals. EMS transports today have been increasing. They have been day after day through this Delta surge, and today the San Antonio Fire Department informed us that they were without enough EMS units for some time. EMS transports are for everyday emergencies as well as COVID-19 patients, and because of the volume of COVID calls, which have reached a record level at any time during the pandemic, we were actually without EMS service for a moment there. And so you see the stress that is occurring in our medical system related to this surge. The development came on the heels of a record number of COVID patient transports yesterday, when San Antonio Fire Department EMS units responded to 117 calls for patients believed to be suffering from COVID-19. Of those, 73 COVID patients were transported to the hospital, which set another record. A reminder, if you need a COVID-19 test, please visit a testing site instead of a hospital if you feel well enough. Unless it's an emergency, please do not go to the ER for COVID-19 testing. Unfortunately, our local hospitals are under severe stress and need to attend to patients who are in critical condition. We have a complete list of test sites at covid19.sanantonio.gov. You can also get that list by calling 311 option 8. Today, we are reporting 1,212 new cases of COVID-19. Our 7-day moving average is now 1,322. 99% of new cases, again, can be attributed to the Delta variant. And if you thought children weren't being affected by COVID-19, please think again. Of the 193 COVID patients that were newly admitted to area hospitals yesterday, 28, almost 15%, were pediatric patients. Due to the highly contagious nature of the Delta variant in COVID-19, and it's infecting more and more children under 12, none of whom are eligible to be vaccinated. More pediatric cases means more pediatric hospitalizations, regardless of the severity of disease, on a case-by-case basis. That's why masks are so important for our younger population and for the rest of us, and why it's critical that if you're eligible to be vaccinated, you need to get vaccinated. We are sadly also reporting 6 new deaths tonight. We've lost in total 3,658 of our friends, neighbors, and loved ones to this virus. Please keep them in your prayers. Protect yourself, your loved ones, by getting vaccinated and wearing a mask. Finally, I do want to talk a little bit about the vaccines and the progress there. We are seeing an we are seeing an increase in the number of people getting vaccinated with their first dose. That's a good thing. 64.5% of Bexar County's total population has been fully vaccinated now, and almost 80% have received at least one dose. There are now 1,267 patients in local area hospitals. 327 are on ICU, 194 on ventilators. 88% of patients in the area hospitals, again, are unvaccinated. Remember that. Wear a mask, get vaccinated, protect yourself, others around you, our frontline workers, and ensure that the healthcare system has enough capacity to care for everyone who needs it. Now I'll turn it over to Judge Wolf.
Yeah, we had just a small drop in the patients in the hospital today. We can't really put much evidence that has anything about showing any sort of trend, because we had 193 new patients come into the hospital. So I think you're going to see those numbers eventually go up. Now, we have done one thing that we think is helping a little, and it will help more as we go along. I think we opened the Fusion Center. I think the first day we did 22. The next day we did 40. We'll do between 50 and 60 today, and that's Regeneron that's been infused. It takes about 2 hours, and that helps a patient from really getting sick where they don't have to go in the hospital. So that's a positive thing that we're getting done out there. Just to add a couple of other remarks about the danger to children, the American Academy of Pediatrics, just on August the 5th, a few days ago, released their updated data. 4.1 million children have contacted COVID since the pandemic began. That's 14.3 of all cases. Just last week, 94,000 new cases with children. That's a 31% increase over the previous week. Those are national numbers, but I'm sure that we're seeing a lot of that here, and it's just showing the danger of the Delta variant. It infects more people. Most children, are not going to get real sick, but some of them can get very sick and some can pass away. But they can bring that virus home to their parents, their grandparents. They can give it to a teacher. It passes just as easy from those that are 17 and younger as it does from anyone else. So that's why we took the extraordinary measure to go to court, to get a restraining order. The hearing will be held, I think, Monday on whether we will get a permanent injunction. But we're trying to get that done before school starts. So we'll know a little bit more next week where we will. The Attorney General has already made every effort. The governor's made every effort to shoot us down. What they're trying to do, they're putting our children at great, great risk.
Thank you, Judge. And let me turn it over now to Jane McCurley, who is here to provide perspective on what's happening in our hospitals. She is the Chief Nursing Executive at Methodist Healthcare. Jane.
Yes, thank you. Good evening. I'm here tonight on behalf of our healthcare workers. The healthcare workers who a year ago, when we began the first surge, were seen as healthcare heroes. Our community responded with love and support, food and gifts, drive-by parades, buses and motorcycles and airplanes, and we felt so much love and support. It gave us the courage to go in and face our own fears of the unknown in the beginning. Today, those healthcare workers are experiencing abusive behavior by patient families. The patients are being accompanied by family members who are openly hostile to our staff while they're trying to care for their loved ones. Our staff have had verbal and physical abuse while trying to implement guidelines to keep all of our hospitals safe. That means limiting visitation, making sure your mask is where it needs to be above your nose, maybe delaying some procedures, increased waiting time in our EDs. Our patients have been cursed at, our staff have been cursed at, screamed at, threatened with bodily harm, and even had knives pulled on them. We've had to increase our security and actually called on our SAPD for very disruptive cases. It is unfathomable that is occurring, and it has to stop. Our staff are tired. They've had very little time off. Once the pandemic slowed a little bit, all those that delayed care have come in to seek the necessary medical care that they needed. They're tired, they're emotionally, physically, and spiritually drained as they try to provide care for this new surge that has occurred. Please, when you come into our hospitals, be kind, be respectful. These people are doing everything they can to deal with the patients that are in the surge, as well as all of the patients with heart attacks and strokes and other health issues. We need you to be understanding when we ask for you to follow our guidelines, and we need to ask that you treat us with respect as we try so hard to save the lives of your loved one. This pandemic, this new surge, could have been prevented had we had more vaccinated people. Thank you.
Thank you, Jane. And so please understand that this is an entire community working together to relieve the stress and to protect the lives of all of our loved ones, and that includes the youngest in our community as well as the healthcare workers who are caring for them. As always, you can get the latest on COVID-19 by texting COSA.gov to 55000 or by going to the website covid19.sanantonio.gov, where you can get information about our assistance programs, where to get tested, and where to get vaccinated. With that, Chief McCurley, Dr. Kurian, myself, the judge, and Eric Walsh are available for questions.
Can I have a question for the city manager? Mr. Walsh, what is the risk that the city is putting the rest of the community when all of a sudden we're being faced with so much use of ambulances and the EMS workers?
Yeah, great question, and that's why I'm here tonight. Today, for 26 minutes, we had not one EMS unit available in the entire city. We had 39 units today. For that 26-minute period, we can't transport any emergency medical calls, whether it's COVID or not, whether it's someone who's vaccinated or not. That means we're not transporting heart attacks, traffic accidents, or any other sort of medical call. So it is critical. And what we're doing is working with the hospitals to get our EMS units in and out of there as quickly as possible. We're moving resources within the fire department. Fortunately, 95% of our fire crews have at least one paramedic, but the key becomes the transportation to the hospital. And we'll be making some adjustments. As the mayor mentioned at the beginning, we hit a high point yesterday in the number of COVID EMS calls, and I suspect that tomorrow's number will be higher. So it is critical. It affects everybody in this entire city.
Of these calls, are they all going to the hospital, or are they just calls to wherever they're going to for COVID?
So we had 107 yesterday. We had 117 COVID-related calls, and 73 of them transported to the hospital. But that does not reflect the entire EMS call load for the day.
Do you know what the entire EMS call load was so we can
We can get that to you.
and also in terms of, you said 36 EMS units total available yesterday?
There were 39 EMS units today.
Okay. Is that combining all of the hospital systems and the fire department's facilities as well?
Those are just fire department EMS units that respond to 911 calls and transport to hospitals.
What about private ambulance companies? Do we work with them for these?
No, we don't. Usually the private hospitals are doing transfers between. They're not responding to 911 calls.
And Chief McCurley, I did have a question for you. I was wondering if there was a way for you to maybe roughly estimate the amount of altercations that have been happening between patients, families, and staff. I mean, I'm guessing a non-zero number is not great, but do you have an estimate of how much we've been seeing?
It is escalating. We're seeing more occurrences every day. And understand that the majority of our patients and families are appreciative of the care we deliver. It is just a handful at each facility who have been extremely abusive. But there's definitely an increasing number of occurrences every day.
Going back to the EMS response, so the changes from what I'm reading here is that you're going to be requiring mandatory overtime for personnel, and then you're going to be sending the fire cadet class into field operations early.
Yeah, those are some of the structural changes we're making inside the fire department. We do have a fire cadet class of 51 cadets that are scheduled to graduate on September 2nd. They're going to graduate a little early, and we're going to push them out next Saturday. And that's just additional resources we have out in the field.
I want to talk about pediatric cases. Mayor, you referred to the pediatric cases in terms of hospitals. What is the makeup of pediatric cases in terms of COVID for Bexar County right now? Do we have that number?
In the hospital?
Just in general, those that are not in the hospital, like how many have?
So to date, under 18, we have about 13% of all our cases are pediatric cases.
And how is that compared to previous? I mean, we've been talking about how this is impacting the younger people more so often. Is that a higher percentage than what we've seen in past?
So the 13% that I just cited is cumulative to date since the beginning of the pandemic. More recently, we are seeing a slight increase, and it's less than 1% increase. But again, Metro Health, there is a reporting lag, so I think the best estimate of if pediatric cases are going up or down is what Mayor just reports from the hospitals currently.
I know at University Hospital, those that have COVID, the children that have COVID, and those that have the respiratory virus, which is really growing now, doesn't normally start to October, but they're getting it, and they're both viruses. It's about 28% of the ones in pediatric unit have those two symptoms.
Dr. Kurian, Metro Health is reporting 60% of Hispanics in San Antonio are not vaccinated. Why is there a hesitation among this population?
We know racial ethnic minority population typically tend to have lower vaccination coverage, and it stems primarily from lack of vaccine confidence. The reasons are multifactorial. Primarily, it is lack of vaccine confidence. It's possible there's a lot of misinformation, mistrust of the government, mistrust of the vaccine effectiveness, safety. Frontline essential workers not able to take time off from work. So we are taking all these into consideration when we strategize on our pop-up events. So convenience is the key to get this population vaccinated. Our motto has been to take the vaccines to the community and meet them where they are. We are putting a lot of linguistically and culturally competent staff at many of our pop-up sites. We are working with trusted community leaders to be the purveyors of our information, and many of these leaders have been great. They are sharing a lot of their testimonials, sharing personal stories, and we know that compelling testimonials from trusted leaders from the community can go a long way in building up vaccine confidence. So I'm optimistic in seeing these rates go up in the coming months.
Is the city considering offering incentives to encourage Hispanics to receive their vaccines?
Is that a question for me?
Sure.
Oh, we are considering offering incentives for everybody, not just a particular segment of our population.
The mayor referred to an uptick in vaccinations. Do we have a number? Like, is it going up, like, at a good speed here, now that we're pushing, continue to really hound that message of getting vaccinated?
So every week, when you look at the data, we are seeing at least a difference of 10,000 in terms of number of people initiating the first doses. So that's a good sign.
And apologies if I missed this, but did we say how many of the hospitalizations currently in Bexar County are pediatric cases? 13.
So I reported what was pediatric of the new admissions. We had 193 new admissions today, 24 hours, which is an extremely high number we've been at for over a week now. We've seen roughly 200 new admissions a day, which is causing our hospital numbers to go up dramatically. Of that 193, 28 were pediatric cases. We've only been getting that data for the last few days, so we don't have a total census yet, but as soon as we get that, we will provide that to you.
So is this something that we only recently started tracking? Is that why we don't have it?
It's only been recently being provided to us. Obviously, we have a lot of hospitals that need to report their data that way for us to be able to provide it to you. So we've asked for that data. We hope to get a census. But just to give you a glimpse, because I was curious also, is that number bigger? Is that proportion bigger? When we were in our fall surge, I looked at our epi report, and we were only about 4 to 5% pediatric in the hospital at that time. So the numbers that are coming in our new admissions are significantly higher, which stands to reason. We're seeing much more volume of pediatric cases, frankly, because children don't have the luxury that adults have of getting vaccinated at this time. That's why we're asking everyone who can make the choice to get vaccinated to go do it, because you're protecting yourself and you're also protecting the healthcare workers, and of course you're protecting our children.
And something else that Judge Wolf mentioned at University Health, we see kids who have both RSV and COVID. Is that something that hospitals are tracking across the county? Do we have an idea of how many of them have both?
On our conference call today, we asked for that data from all of the hospitals. I just happened to get it from University Bexar County Hospital. But we've asked for them to start providing that, because when you look at what's happening nationwide with a huge 31% jump in new COVID cases with children, we assume that we're seeing a big jump here too. That doesn't mean they're all going into the hospital, but I would assume because of the respiratory virus and the COVID that we'll probably continue to see those numbers grow.
We have another question from Metro Health. How many schools have reported cases of COVID-19?
This school year, multiple ISDs and multiple schools have already reported, and top of my head, about 50 cases have already been reported from schools.
For this school year?
Cumulatively, we have about, since beginning of the pandemic, about 6,000 cases.
Mayor, we talk about being at the brink of the system, the hospital system, to collapse. At what point are we at right now, and when? At what point will be, or you will say something like, you know what, people, our local system collapsed today. At what moment, and what is that flexibility that you have at how many patients or something like that?
Well, I mean, I'm not going to speak for the hospitals, and you heard it from Chief McCurley. Those folks are going to work and try to protect as many lives as they possibly can. But from our vantage point, when you start suspending elective surgeries, when you have what the governor has had now, a call for other states to send us nurses, which we've been asking to do for weeks, that he's gone outside now and said, we're in trouble. We can't help ourselves because our hospital system capacity is already stretched beyond its limit. We're at that point. And you just heard from the manager, Walsh. We had 26 minutes today where we didn't have transports. We didn't have EMS transports. We are at that point. And the sickening part of this whole thing is that it's preventable. It's very easily preventable. Get a vaccine, doesn't cost any money, it's safe, it's effective. It had the most vigorous testing in the world for vaccines. It's there, it's ready for you. It'll save your life, it'll save the lives of those around you, it'll protect our children, it'll help our children go back to school safely and help our economy open. And then in the meantime, with this Delta variant, which has got as clear data as we've ever seen in terms of how fast it's spreading, wear a mask. Is that step too hard in exchange for all those other things I mentioned?
You know, the hospitals, of course, the governor finally reversed his order. He refused to do it 2 or 3 weeks ago and then opened it up. But that process is kind of convoluted. We're having to make new applications. I'm not sure how long it will take to get them. I'm not sure what the other hospitals are doing, but I know at University Hospital, they're making efforts to go out and contract for some nurses themselves and bring them in. So the hospital capacity is there as long as we can continue to bring in enough support, staff support, to help people. We had 1,520, I believe, in the hospital last winter, but at that time, we had something like 1,600 nurses coming into San Antonio. I know the hospitals are doing everything they can. They're juggling elective surgery. They're trying to, maybe in some cases, a nurse has to handle 2 patients in ICU. It's a difficult problem that they have. And as stated just a little while ago, compounding that problem is some of the people who are clogging up our hospital system, the unvaccinated, are getting a little bit unruly, the families are, with the nurses, and that even compounds it more. It's a terrible stress on nurses and people that are helping these patients. I expect, you know, that we're going to get up to that 15, 20, or maybe even beyond that.
In terms of support, I know the governor has asked for more out-of-state help. Do we know or have any indication how much help will be coming to Bexar County in terms of hospitals, for our hospitals?
They asked for what, 500?
550.
550. 550, I think, is their application in for. I think the University Hospital is trying to locate 150 through their own contracting.
Yeah, and that request for 550, though, I'll point out, was made, I think, 2 weeks ago.
At least.
When we were at
So
600.
obviously things have have changed a little bit, and so have they around this entire state. So we're not the only region that's stressed.
That's right.
Everybody is going to be asking for those 2,500. There were many, many more thousands than that during the height of the fall surge, and we're in even more dire shape as a state than we were back then.
Governor's put us in
Has our
jeopardy by waiting 2 weeks when he could have done this so easy before. It's all refundable by FEMA. Didn't cost the state a nickel, but they just refused to do it 2 or 3 weeks ago. And finally, they see where we are today and they're finally doing something.
Has the state informed our community how many nurses might come to San Antonio, and if so, how many?
Dr. Curry, go ahead.
So based on the reports from STRAC, about 300 of those 2,500 are coming to the region, this region. And I believe STRAC's asking for additional assistance.
But to make it clear, in terms of the request and of those 300, they're not here yet.
No, not yet.
And have any school districts or other public school, charter schools pushed back on the mask mandate since y'all issued that?
Well, I've talked to a couple, I don't want to name names, but I think you're going to find that some of the more reluctant ones to impose it will probably wait till next week. By the way, some of the districts are not fully back in school yet, so they do have a little time to make their final decision. And I think we will know, well, we know we got a hearing Monday. We know they'll appeal to the Fourth Court of Appeals. They're trying to get around the Fourth Court of Appeals and go directly to the Supreme Court. Hopefully that won't happen. But we'll have a pretty good sense of, well, somewhat of a sense, I guess you could say, where we are. If the injunction is done permanently, then some of these school districts that are been reluctant, may change their mind.
And think about that scenario just for a minute, because we know from the CDC, we know from our own doctors, what will solve this crisis is people slow down the transmission of this virus and get people out of the hospital. Wear a mask, get vaccinated. Okay? We know that will work. That's in our hands. We can do that at the local level. But right now we've got a situation and a legal battle playing out in which we're having to defend our right to protect ourselves. Meanwhile, the state is having to go outside, asking outside for help for a situation that's getting exacerbated because we're being prevented from using the tools that are right here, locally available, and free.
And what's so upsetting about it, the governor signed a face mask mandate, last spring, or a year ago, I guess. He let us do it at all the business. He was very supportive. Now, all of a sudden, it's a violation of your freedom. You know, you have to, can't text in a car, you got to give signals, you can't speed, you got to wear a seat belt. Those are all, offenses if you get caught. Wearing a mask is minor compared to some of the things that people are required to do.
And going back to the lawsuit, I know that the governor and attorney general have appealed to the Fifth Court in terms of the Dallas County TRO, which is very similar to ours. Do y'all know how that affects us, or have they also gone to the appellate court for us to overturn that on our behalf?
The Dallas court went further than we did. They mandated it for all businesses. We didn't do that. And so our order is more restrictive. There's really two major things: the school mandate, and then second, mandating it right here for our county and city facilities. I think city manager imposed that just yesterday on city. We imposed it at the courthouse, and the sheriff's enforcing it for us. So that's only two things we did. Those are very reasonable, not stretching beyond that. So hopefully they're going to look at our case differently. Don't know, but hopefully they will.
And to point out, completely in accordance with what we're hearing from the federal health authorities at the CDC.
Yeah.
And is there any intention to add public higher education institutions? I read that Dallas County did that within the last hour. They're public, so I'm wondering if that also falls within Metro Health's authority to mandate masks.
That does not at this time, and as we've talked about before, we are going to stay aligned with the CDC recommended guidelines for mitigating the spread.
Do you know whether there's a stress and a lack of availability of pediatric ICU beds in our hospitals?
We will get that information for you.
Dr. Kieran, do we know how many vaccinated people have died?
6 to date. And I just want to point out, all of these have been in 60 years and older with multiple underlying conditions.
Say that again, I'm sorry.
Yes, all 6 deaths have occurred in 60 years and older with multiple underlying medical conditions.
And I think it's important to note that you would still strongly encourage for people to get vaccinated, though, because I think when people say, okay, they still died even though they were vaccinated, I think it's still important to push that message.
And multiple underlying medical conditions that probably attributed to this
Again,
mortality.
don't forget the number. 99.5% of people that have died were not vaccinated. Those are very, very strong numbers.
Just one more question about vaccinations. Y'all said there has been a slight increase in people getting their doses now. Is there a way we can quantify that, like have like 200 people more than usual come in to each site?
So we track that on weekly basis, and like I mentioned earlier, we are seeing about 10 to 11,000 people coming in every week, more than what we documented the previous week.
That's all the questions we have tonight. Thank you.